Surgery is a big deal, and what if I told you there was a secret sauce that could actually improve your recovery and might accelerate your rehabilitation? Well, if you're curious, stick around. Hello and welcome back. I'm Adam Rosen, and thanks again for tuning in. If you could do me a favor right now and click the thumbs up like button, it really helps people like you find content like this. In today's video, I want to talk to you about perioperative nutrition. So that is nutrition both before and after surgery. And you might be surprised to hear that we need an extra 2,500 to 3,000 calories a day to heal from the trauma of surgery. And I'm sure that a few of you right now are thinking, yeah, but I eat healthy already. Studies have been actually done looking at this, and they find that up to 50% of surgical patients were malnourished when we look at particular lab values. And that's a big deal, because if you're malnourished after surgery, that can delay wound healing, and delayed wound healing can lead to an infection. It can also slow your recovery due to muscle atrophy and weakness, and that can impede your ability to hit the ever-important milestones with physical therapy. Now, for years, I've recommended to my patients the use of an over-the-counter essential amino acid supplement, and that was based on 2 scientific studies that looked at that supplement and found that patients had less muscle atrophy and better muscle recovery. And I saw improvements in my patients when I started recommending this supplement to them. And nutrition is something that a lot of orthopedic surgeons are talking about now. Even within our group, we talked about it. And we've made it important to educate our patients about nutrition before surgery. So for surgical patients now, I'm recommending that you want to add in a multivitamin and add in vitamin D, and these have been shown to be helpful. But the other important thing that I talk to patients about is protein supplementation perioperatively. Again, protein supplements before and after surgery. And when I first bring up the idea of protein supplements, patients are thinking Ensure and Boost or Glucerna if they're diabetic. One of the supplements I recommended to a lot of my hip fracture patients over the years was Kate Farms. And these are general over-the-counter supplements that you can find, but a number of companies have now started making surgical patient-specific protein supplements. So companies such as Complete Surgical Nutrition and Root and Mend now offer products that are made specifically for patients undergoing operations. These are recommended typically twice a day, so to be taken in addition to meals, not as a meal supplement, 1 week prior to surgery, and then again twice a day for 2 weeks after surgery. Like any supplement, you should always check with your doctor and make sure that they're safe for you, especially if you do have kidney disease. Higher levels of protein can be an issue for you. I first heard about these companies at meetings, so talking to friends and colleagues, and I started hearing from a lot of colleagues their patients were using Mend and they were seeing improved recovery. They were seeing better outcomes and patients just overall felt better, something hard to sort of measure, but they saw this improvement in their patients. There's a bunch of surgeons out there that are now using these products. So Dr. Paul Jacobs, he even says that he sees the enhanced recovery in his patients that are using Mend after total joint replacement surgery. And Dr. Andrew Wickline saw improved wound healing. Now, surgery is always evolving. We've evolved with our surgical techniques. We've modified pain management protocols and physical therapy. And now the next big kind of thing that we're all talking about is surgical nutrition. So we're seeing a lot of these patients that are optimizing their surgical nutrition both before and after surgery, and this is actually helping them to recover better, quicker, faster, and can potentially lower the risk of complications. So I hope you've found this information interesting and helpful. Like always, if this is something that you're thinking about using, talk to your surgeon or your primary care physician to make sure that it's appropriate for you. Mend has graciously offered a 5% discount to any listeners that are interested in using their product. I'll put that link in the show notes. And until next time, and as always, stay safe.